Hello, I'm Beth Wagner, Doctor of Physical Therapy. Today I'm going to show you 5 excellent exercises to decrease neck pain and begin healing from whiplash. Whiplash is a term used to describe sudden, fast movements of the head following some kind of jarring motion to the body. The most typical causes of whiplash include motor vehicle collisions, falls, and sports injuries. The movements can occur in any direction. It may be a combination of forward-backward movement, side-to-side movement, or even angular or rotational movement, depending on the angle of the collision, whether that's taking place in a vehicle, whether that's a fall onto the ground, forward or backward, or to the side, or whether it's a collision with another player during some type of sports competition. What happens during whiplash is that the neck doesn't have enough time to respond to such a fast movement, and sometimes to a very large movement, which causes tissues in the neck to become overstretched. The injury can affect the joints, the ligaments that support the joints, and the muscles that surround the cervical spine. Now, in response to this injury, muscles on all sides of the neck tend to tighten and guard in order to protect the neck from further injury. This can cause pain, stiffness, tightness, difficulty moving your head in all directions, and sometimes even difficulty lifting the arms. So while it's normal for this pain and tightness to occur right after the injury, we want to prevent it from becoming a chronic condition. So our initial goal of recovery is to begin small, gentle movements of the head and the neck, and even the shoulder blade and shoulder girdle. This will help to reset the muscles, the joints, the ligaments, all of the tissues in the cervical spine. If these small movements are tolerable and not painful for the neck, then the muscles will slowly begin to relax and let go of that guarding and protection. This process takes time and many repetitions. So the key is to be consistent with these exercises, performing just a few repetitions at a time with slow, gentle movement throughout the day. Posture is very important too. Be sure that you're doing these exercises with correct posture, which we'll start with in just a moment. And also be sure that you're monitoring your posture throughout the day. If you find yourself slipping into slouched, tight posture during the day, that will only tend to worsen the guarding of the muscles in the neck and continue to exacerbate the pain. As you catch yourself in poor posture, be sure to correct your posture right away. Oftentimes you'll notice a decrease in pain just by simply monitoring and correcting your posture. If you're experiencing any numbness, tingling, sharp shooting pain, or pain running down either of the arms, or sharp, severe headaches, please see your doctor before you start these exercises. If you experience these types of symptoms while doing these exercises, stop right away and see your doctor. In addition to consulting your doctor, you'd likely benefit from seeing a physical therapist for an individualized evaluation and treatment plan to best meet your specific needs and help you get back to your baseline as soon as possible. Okay, so let's go ahead and do the posture correction, and then I'll show you these 5 excellent exercises. Sitting in a supportive chair, pay attention to where you're weight bearing through the base of your spine and down into your pelvis and your buttocks. The weight should be right through the middle of your sit bones, right through the middle of your hips. Now moving up to your lumbar spine or your low back, be sure that you still have a bit of an arch in your lower back. Lift your chest and relax your shoulder blades down and back. Now moving up into the head and neck, let's perform a slight cervical retraction or a chin tuck. Pull your chin straight back, not bringing your chin to chest like that, but straight back. This should be a slight movement. This is just to help get you out of any forward head posture you might be in. Ideally, your ears should be lined up right over the top of your shoulders. Now just shake your shoulders a little bit. Do a little bit of a gentle movement of your head. Relax your jaw, just to be sure that everything is relaxed as possible as we start these exercises. The first one is a cervical retraction. Starting in this tall, upright posture, draw your chin back a little bit farther than you did for the posture correction just a moment ago. Pause in this position and then relax your chin. And inhale to prepare for the movement. Exhale as you retract your chin. Pause there and then relax. and continue. Now this movement might look very small on the camera, and it is a pretty small movement to start with. If this feels comfortable for you, go ahead and try to pull your chin back even a little bit farther. So on your next exhale, pull that chin back. See if you can give yourself a bit of a double chin. Pause and relax. And again, tuck your chin, pause, and relax. Perform 5 to 10 repetitions of the cervical retraction or chin tuck, as many as you feel comfortable to start with. You will likely find as you do this more and more, you won't have as much available motion because you're already retracting your chin and you're finishing in a tall, upright, neutral posture. That's just fine. Feel this out. This is a great opportunity to become more aware, to notice what's going on in your cervical spine. Play with it. None of these exercises should cause sharp shooting pain, headaches, numbness or tingling, anything like that. It's normal to feel a little bit of stretch discomfort. That will improve as you do these exercises day by day with more and more repetition. Number 2 is scapular retraction and depression. Starting with a little bit of a chin tuck, just to be sure you're not starting in forward head posture. We want neutral posture here. Draw your shoulder blades back and down. You can have your arms relaxed here in your lap or along your side, wherever you're most comfortable. Inhale to prepare for the exercise. On your next exhale, squeeze the shoulder blades together in the back and slide them down your back as if you're putting them in your back pockets. And then relax. This is the exact opposite of lifting the shoulder blades up and forward. Sometimes that helps to see what motion we're not doing with this. So let's start again. Wiggle your shoulders a little bit and squeeze the shoulder blades back and lower them. And relax. Again, on your next exhale, squeeze your shoulder blades back and down and relax. Inhale to prepare. Exhale, squeeze your shoulder blades back and down and relax. Another way of seeing this exercise is a bit of a half circle where we're pulling back and then lowering down. So we're performing a half circular motion backward and relax. Continue 10 to 20 repetitions or as many as you feel comfortable with to start. Build up gradually with repetitions as you do the exercises day by day. Number 3 is a small head nod. Starting with tall posture again, inhale to prepare, and as you exhale, look down and tilt your chin down towards your chest just a little bit. Pause, and then look back to the center, and then look up just a little bit. Pause, and come back to the center. On your next exhale, tip your chin down as you look down toward the floor. Pause briefly, come back to the center, and now look up as you lift your chin up just a little bit. Pause, come back to the center. Again, this is a slow, small movement. Let's continue. Look down, chin down, pause. Back to the center, and now look up, chin goes up a little bit, and back to the center. Continue 5 to 10 repetitions. Looking down, chin down, come through the center, and look up, chin up, come back through the center. Number 4 is a small head turn. Starting with tall posture, a little bit of a chin tuck. On your next exhale, turn your head to the left just as far as you feel comfortable going. Pause there. Come back to the center and keep right on going over to the right side. As far as you feel comfortable, pause and come back to the center. And continue alternating left and right head turns. Go just as far as you feel comfortable. Keep the motion slow, small to start with. Gradually increase how far you're turning, day by day, repetition by repetition. Don't push this motion. Keep it small and comfortable. Good. Now you can pattern your breathing with this, exhaling as you start the motion, inhaling as you come back to the center. Exhale, turn, inhale, come back to the center. See if that breathing pattern with all of these exercises feels comfortable for you. You can always adjust it. The point of monitoring your breathing is to be sure that you're not holding your breath. Breathing throughout these exercises is an excellent way to further decrease pain. It helps to reset and to calm the nervous system. It also helps the muscles to relax and to be able to do their job appropriately, where they contract when they're supposed to and then they relax when they're supposed to. Holding our breath encourages the muscles to stay contracted and tight. It's very difficult to relax a muscle while we're holding our breath. So continue breathing at a comfortable rhythm as you go through these exercises. All right, the last exercise is a side bend. Again, starting with tall posture, a little bit of a chin tuck. Looking straight forward, we'll tip the right ear toward the right shoulder. Just as far as you feel comfortable, pause. Come back up to center and keep going to the left side. Pause. And come back up to the center. Exhale as you tip. Pause. Inhale back to the center. Exhale, left ear to left shoulder. Pause. Inhale, come back to the center. As with all of the other exercises, keep the motion small and slow. Gradually increase how far you're moving day by day as you increase the repetitions and as you feel more comfortable with the exercises. Okay, in addition to these exercises, I have some other recommendations for you. Once you start to notice the signs of inflammation subside, then you're likely ready to move on to some strengthening and stretching exercises. Now, as a reminder, signs of inflammation include swelling, redness, warmth, and throbbing pain. Once those signs of inflammation decrease, you're likely ready to move on to some strengthening and stretching exercises in order to restore muscle balance, stability, and flexibility in your neck. Now, I've posted other videos with those exercises. I'll also include those links in the description below. Feel free to combine these exercises with more advanced progressions in the other videos. Another key component to recovering from whiplash is positioning during sleep and pillow support. Now, I've also done a whole video on that, and I'll include the link in the description below. The key there is maintaining neutral posture while you're sleeping. So you want to be sure that your pillow offers adequate support for the base of your neck and support for the base of your head that doesn't push your head too far up or allow your head to sink too far down into your mattress. So check out that video for more specific information. I'll also include a link in the description below for my posture correction video, which offers a lot more in-depth information than I've included in this video, and it can be very helpful for long-term posture correction to improve the health of your entire body, and it will help improve your recovery from this whiplash injury. Now, when is it okay to return to your usual activity and sports? Many people ask that question. Recovery time varies greatly from person to person. It depends on many components, including the severity of the original injury, any previous history of injury, and all sorts of components having to do with each individual person. A couple of guidelines include decreasing any severe throbbing pain to a minimal level and recovering full range of motion of your neck. It also depends greatly on the type of activity that you're wanting to return to. In general, I recommend a slow, gradual, progressive return to your activity. For example, if you're a runner, start by walking, increasing the duration of your walks, then doing a few walks and runs, and then finally building up the distance of your running. And do that over days to weeks to even months. If you experience a setback, it's okay. Don't worry about it. Just go back to a previous level of activity. Return to these exercises. You might need to do a few days of icing again to calm your neck, and then go ahead and return to that progressive buildup of activity. I hope these exercises are helpful for you to recover from your whiplash injury, to resolve your pain, to restore your motion, and help you get back to doing the things you love to do every single day. If you like this video, please give it a thumbs up and consider subscribing to my channel. If you have any questions or comments, leave them down below and I'll get back to you as soon as I'm able. Here's to your healing, health, and happiness. Have a fantastic day.